How do immunotherapy mechanisms compare to chemo? Imagine fighting cancer with your own immune system instead of just chemicals. That's the core difference between immunotherapy and chemotherapy in treating colon cancer. Chemotherapy works by attacking all rapidly dividing cells, both cancerous and healthy, which is why it often causes side effects like hair loss, fatigue, and nausea. It uses drugs that damage the DNA or cellular machinery of these fast-growing cells, leading to their death. This approach is nonspecific, meaning it can harm normal tissues, which explains the common side effects. Immunotherapy, however, takes a different route. It boosts or reactivates the body's immune defenses to recognize and destroy cancer cells. One common type involves immune checkpoint inhibitors, which block proteins like PD-1 or CTLA-4. These proteins normally act as brakes on immune cells, preventing overactivation. When these brakes are released, T cells can better identify and attack cancer cells. This mechanism is especially effective in tumors with high microsatellite instability or mismatch repair deficiency, which have many genetic mutations making them more visible to the immune system. In terms of effectiveness, immunotherapy has shown promising results for patients with metastatic colorectal cancer whose tumors are MSIH or dMMR. These genetic features are present in about 4 to 18% of cases, depending on the stage. For these patients, immunotherapy can improve survival and delay disease progression more than traditional chemotherapy. But for the majority of colon cancers, which are microsatellite stable or MSS, immunotherapy alone has not demonstrated superior results. For these cases, chemotherapy remains the main treatment, often combined with other drugs to boost its effectiveness. When it comes to side effects, chemotherapy's broad attack on dividing cells leads to a wider range of issues, including nausea, hair loss, immunosuppression, and fatigue. Immunotherapy tends to cause fewer side effects, but it can sometimes trigger immune-related adverse events. These include inflammation of healthy tissues like the colon or lungs, which can cause conditions such as colitis or pneumonitis. However, these are less common and often manageable with medical care. Emerging treatments like CAR T-cell therapy, which involves engineering a patient's T cells to better target cancer, are being studied for colorectal cancer. While promising, these approaches are still in experimental stages and are not yet standard practice. For those with metastatic colon cancer, testing for MSI or mismatch repair deficiency is crucial. This helps identify patients who might benefit most from immunotherapy. It's important to remember that both treatments requiring careful management and personalized medical advice. Chemotherapy remains essential for many, especially those without MSIH or dMMR tumors. Both therapies have their strengths and limitations, and choosing the right approach depends on the tumor's genetic makeup and the patient's overall health. Ultimately, understanding these differences helps doctors tailor treatments that are most effective and safest for each individual.